All right. Good morning, everyone. Thank you for joining us on day 2. As Astrid mentioned, Minhthu and I are going to be doing a joint presentation on the Healthy Nail Salon Recognition Program. We're going to be providing you guys an overview of our program, some collaboration and outreach we've done, and also address some of the outreach hurdles and gaps, especially during the COVID-19 pandemic. Again, Minhthu is from the city and county of San Francisco, and I am from San Mateo County. Next slide, please. So I first want to kick it off with some brief program history of the Healthy Nail Salon Recognition Program for those who may not know about the program. So the program was started due to the growing health concerns for exposure to hazardous chemicals found in nail products. And this really impacted not only the nail technicians, but also the customers as well. So it's really a whole person issue in terms of the customers and from the nail technician side. And as a result to this, the Healthy Nail Salon Recognition Program was started. And this program has been around for many years now, over a decade now, actually, which is a really big milestone. It was really first started in 2010. There was a foundation laid when the California Healthy Nail Salon Collaborative raised awareness using outreach campaigns around these issues. In addition to that, the city and county of San Francisco adopted an ordinance in 2010 to further encourage and this voluntary program and have folks ban specific toxic trio products or encourage them not to use them, such as formaldehyde, toluene, and dibutyl phthalate. And fast forward 2012 to 2022, our programs exist in multiple Bay Area jurisdictions, including San Francisco, San Mateo County, Santa Clara County, Alameda County, and the city of Santa Monica down in Southern California. And in 2016, a really big milestone happened where AB 2125 was passed, which many of you may be familiar with, which called for the statewide support of these voluntary Healthy Nail Salon programs all throughout California. And currently the program is being implemented by DTSC, or the Department of Toxic Chemicals. And with that being said, I do want to mention that we do have a variety of programs throughout the Bay Area in addition to city of Santa Monica. But I also want to mention that this program isn't exclusive to California. There are many other states who have gained interest and also grown momentum with these programs, such as Michigan, even people as far as Canada. We have King County and Washington also that has interest in this program, in addition to New York, who's also started their own programs. Next slide, please. I also want to take a moment to piggyback off the last slide and also highlight some of the main program criteria that we use to certify salons to become a recognized healthy nail salon. So there's 3 main categories to becoming a healthy nail salon. The 3 categories are safer products, safer practices, and better ventilation. So safer products, again, free of the most toxic chemicals, those toxic trio chemicals that I mentioned, which are listed here: formaldehyde, toluene, and dibutyl phthalate, or DPT for short. There are many other chemicals. I just want to put that out there because it's not just exclusive to these 3, but these 3 have been found to be very hazardous in terms of causing respiratory issues, asthma, birth defects, etc., you name it. In addition to that, safer practices is a very important part of this program, including PPE such as gloves and masks, especially during the COVID-19 pandemic. This has been really something that has been highlighted as very important for safety, and also designated area to perform certain services to avoid toxic fumes and dust. In addition to that, ongoing training that coordinators of these counties and people that run these programs provide nail salon technicians to make sure they're up to date on the safest practices when performing nail services. And lastly, ventilation is also very important. Being able to provide general ventilation, whether leaving the door open or having windows open during times of services during in the salon to promote better airflow and quality, in addition to having localized ventilation at certain stations with larger ventilation units to suck up toxic fumes and dust, is also a really important component of this program to reduce exposure to the chemicals. Next slide, please. And this slide is also just a continuation of more details in terms of what exactly is the program criteria. I don't want to read through this exhaustive list, but I just wanted to mention that there are about 10 program criteria that it takes to join the Healthy Nail Salon Recognition Program. And again, they fall under the category of safer products, practices, and better ventilation. Next slide, please. And I really want to take a moment here to also highlight some of the collaboration we've done in the recent years and ongoing collaboration we continue to do. So first and foremost, we have a Healthy Nail Salon working group that meets every 2 months. This is a collaboration effort between the Bay Area counties that have a Healthy Nail Salon program, the city of Santa Monica. We have the Department of Toxic Substances and Control on these calls, in addition to California Department of Public Health and other interested stakeholders, whether they're in California or not, who participate on these calls. And this call really serves a purpose for us to collaborate and share ideas and nuances in the latest research when it comes to nail products and chemicals, and also to ensure that we're on the same page when implementing the Healthy Nail Salon program criteria and troubleshoot any issues that may arise. And it's a really great way to also keep each other connected and updated on what's going on at each individual Healthy Nail Salon programs. There's other 2 examples that I want to share in terms of recent collaboration we've done over the years. Back in 2017 to 2018, there was an Environmental Protection Agency or EPA grant, the Microloan Pilot Program. And this partnership was between, again, the Bay Area counties. We also partnered with other stakeholders that were new at the time, Federal Reserve Bank of San Francisco, and 2 microlending nonprofits. And this grant really served the purpose to implement and distribute 0% interest loans, which was huge to help salons that were interested in joining the Healthy Nail Salon program, but didn't have the monetary resources to join. And this allowed them to be able to take out a business loan for the purpose of joining Healthy Nail Salon program with the 0 interest, and allow them to pay back the loan in a less stressful and more meaningful timeframe in order to join the program. One of the biggest hurdles to joining this program is that ventilation unit that I mentioned on the previous slide. That ventilation unit can be very costly. It can run from $1,000 to $3,000, depending which model you get. And that is a very big barrier to joining this program. So this grant was really huge and monumental in getting salons to join the program back during this pilot time. And lastly, one other outreach example that I do want to share that San Francisco and San Mateo County collaborated on in the recent years was back in 2019. We ran a joint customer awareness campaign. And again, this was a collaboration between San Mateo County and San Francisco County. We really utilized a mixture of digital and traditional media tactics, everywhere from newspaper ads, ethnic media ads, bus shelter ads, and also pictured in this photo on this slide is actually an example of a bus shelter ad that was in San Francisco during the time of this campaign. So you'll see here that our tagline was "Pretty Shouldn't Stink," and this is just an example of one of the many tactics that we used. We also utilized more up and coming digital media tactics such as social media on Nextdoor, Twitter, and sponsored Facebook posts, in addition to Google ads as well, to target this population of nail salon customers to raise awareness about these issues that the nail salon community is facing. That being said, I am going to transition this over to Minhthu, who's going to talk more about some best practices when it comes to outreach, and also mention to you guys some of the gaps and hurdles that we've been facing currently in the program, and especially in light of the COVID-19 pandemic. Thank you.
Thank you, Connie. Next slide, please. Good morning, everyone. I will share a few tips that we've been using for recruiting since the program started. Almost all the nail salons in California are Vietnamese speakers. So it's easier when you're having staff that can speak Vietnamese. Also, outreach material available in Vietnamese is a plus. As you can see, right here is the 2 brochure that Healthy Nail Salon in San Francisco use. So we use the Vietnamese and also the English version. So the best time to visit salons are prefer early weekdays, like Monday through Wednesday. Definitely not in the weekend because there will be more customers and busier at the salons. Other industry usually use phone call or mail brochure to businesses, but in-person recruiting is the best option with nail salons. Your staff can face-to-face interact with the owners and the workers to establish relationship. Follow up within a week or maximum of 10 days later to give owner more detail about the program and answer their questions. Offer free or discount ventilation unit, the local ventilation unit, or free and also free marketing for salons. If you know someone that can connect you with the owner or the workers that work at a salon, it will be easier to start a conversation. Just dress casually when you go into salons, not business attire. Definitely don't bring binder or clipboard on your hands, because that's a red flag for the owners and the workers. They view you as an inspector from the California Board of Cosmetology, so the conversation usually don't go far. Or you can come in as customers, get manicure, pedicure done, and start a conversation right there. So COVID safe tip that we developed during the COVID time at the beginning, we switched the annual visit to virtually and through phone call or text messages follow up, especially not go into salon when it's full. Next slide, please. Speaking of the pandemic, so during the pandemic, staff done things that we never done before in the program. So we email update guideline from the county and city to the owners, when salon can open, how does the social distancing look like, what service can and cannot offer, and also mask requirement. We help connecting salon to give feedback for best practices for COVID mitigation. We send info about small business grant to owners, what the website and what link to applications. In addition, we distribute PPE from the state, include masks, hand sanitizer, face shield to salon by collaborating with the CBO Southeast Asian Community Center in the Tenderloin. Next slide, please. So right now, nail salons are still hurting from the pandemic because we all know this industry got hit really hard. Before the pandemic, it used to be difficult to convince owner and workers to wear gloves and masks, open doors and windows. However, this has changed since during the pandemic. Everyone wear gloves and masks, and we also seen more doors and window open. Definitely need funding to run the program, especially to provide incentive. Free or discount local ventilation units often cost thousands of dollars, like Connie mentioned. The law requires some safety data sheet on products, but not always available by manufacturers, as you heard from the video from the movie yesterday. So there are more products coming out in the market so often that we don't have time to verify if the new products are better than the current one or not. We have this really good program, but ultimately we need more regulations to eliminate the worst ingredient, to make sure that the product is safe before they come out on the market for professional and consumer use. Next slide, please. Next slide, please. Thank you all for listening to our presentation, and here are Connie's and my contact info. Please reach out to us if you have any questions and if we can help you with anything. Thank you, everyone.